It is no secret today that our world is being plagued by the novel coronavirus. But what if I told you it wasn't the first time that the world has seen this type of virus? Would you believe me? Well, in China, in 2002, there was the first outbreak of what has come to be known as SARS. It is this virus that has come back with a slightly different version. In order to fully understand the COVID-19 outbreak, you must look back at the first coronavirus to attack this century, SARS. You must look at the comparisons between COVID-19 and that of SARS and how it affected the world. Today, I will first go through the background of SARS and COVID-19 and what exactly they are, the similarities and differences between the two, and what SARS taught Hong Kong and what Hong Kong's advice is to the United States. The background of both the viruses starts with them being from the same virus family, coronaviruses. Both are zoonotic and develop in animals before transmitting to human hosts. SARS stands for Severe Acute Respiratory Syndrome. The 2008 Journal of Aging and Mental Health states that SARS has been characterized as the first global epidemic of the 21st century. It first occurred in China in November of 2002, before becoming a major issue in February of 2003. From there, it began to spread globally. The WHO, or World Health Organization, accounts that in 2003, the epidemic of SARS affected 26 countries and resulted in more than 8,000 cases, including the United States. Its general symptoms include a high fever, a headache, a lot of discomfort, body aches, 10 to 20% of people have bowel issues, and for mild cases, they have mild respiratory issues that occur because of a dry cough, which will stem over evolving into pneumonia, which scars the lung tissue and can cause death. 8,098 cases were diagnosed, and of those, 774 people died. This makes the global mortality rate 15%, which is significantly high for a disease. It wasn't until July 2003 when SARS was only eradicated, not cured. It wasn't until 2019 that we see this novel coronavirus begin to take the title of the deadliest of the 21st century. COVID-19 is a sibling disease of SARS. Its scientific name is SARS-CoV-2. The medical news today reports that the virus shares about 86% of the same genomic sequence with SARS. It was first reported in Wuhan, China, in December of 2019, and has since spread to 210 countries and territories. Its general symptoms include a low fever that increases over time, short breath, dry cough that continuously gets worse, and noticeably, not everyone has these symptoms. So the other symptoms they might experience are loss of taste, fatigue, body ache, chills, congestion, headaches, sore throat, pink eye, digestive issues, sudden confusion, and in severe cases, it will go over to pneumonia, which can scar the lung tissue and cause death. As of April 16th, 2,173,334 cases have been diagnosed. Of that, 145,072 deaths have been concluded. This number continues to rise, and deaths in the United States include 34,475, which is an incredible amount opposed to other countries. Overall, this makes the global mortality rate 3.4%, which, as you all have probably noticed, is significantly lower than that of SARS. There are some notable differences between the two viruses. Some similarities are, as I previously referenced, they are from the same virus family, coronaviruses. They are both zoonotic, and they first occurred in animals and then jumped to human hosts. They spread through respiratory droplets, and they originated in wet markets, which is an open-air market that sells and kills live wildlife and animals. This can overall contaminate products and spread diseases. Another similarity is they both are severe respiratory syndromes, They start with fevers, and they attack those who are above the age of 60 and those with underlying illnesses more aggressively. There is no cure and no vaccine for either of them. Some differences are COVID-19, unlike SARS, has a much longer longevity, more like the flu. So that means how long it lasts in the system is a lot longer, which makes it more of a stable virus. COVID-19 and SARS both have differences in their spike proteins. COVID-19, its proteins stick more to the membrane than that of SARS. The medical news today indicates that COVID-19 has a specific structure that allows it to bind at least 10 times more tightly than the corresponding spike proteins of SARS to their host cell receptors. There is also an element in our human cell that makes us more vulnerable to that of COVID-19. The other big difference that you probably have all noticed is SARS is way more lethal than COVID-19. Overall, many countries have been impacted by SARS as well as COVID-19. Specifically, Hong Kong had more experiences with SARS than that of COVID-19, but it wanted to give some advice to the United States as well, from learning from its SARS experience. In February 2003, the SARS virus jumped from China into Hong Kong. Originally, the response for Hong Kong started off slow. They had not yet fully understood what the SARS virus was, and they only knew it to be transmitted by respiratory droplets. That wasn't until the Amoy Gardens complex incident. The 2006 Journal of Environmental Health explains that high concentrations of viral aerosols in the building's plumbing were drawn into the apartment bathrooms through floor drains. When the wind shifted, the air from this building then blew over to other buildings. So, overall, everyone in the building where the aerosols contaminated the building got infected, and then everyone in the surrounding buildings got infected. In total, 300 people got infected. They call this super spreading, and because of this super spreading, it forced the Hong Kong officials to take action. But it was already too late for the 299 people who had already perished, which according to Amnesty was almost 2/5 of the total of global deaths. This ultimately traumatized Hong Kong to the point where they always wear surgical masks when they're sick. And when it came to COVID-19, they automatically went into lockdown and followed social distancing rules. As of March, Hong Kong only had 120 cases. They do give some advice for the United States, and that is to take the testing you are given. If you had all noticed, our response on COVID-19 was delayed 6 weeks, and that is because our government chose to not take the WHO testing. In that case, we had to make our own. The other thing they said to follow is social distancing, and this will ultimately flatten the curve. So today, I went over SARS and COVID-19, what they are, the similarities and differences between the two, and what SARS had taught Hong Kong and what Hong Kong's advice is for the United States. See, the past can bring forth information to help the present. So in order to fully understand the COVID-19 outbreak, you must first go back to the first coronavirus to attack this century, SARS. You must compare it and then look at how it affected the world. SARS had taught Hong Kong about the new normal, which helped them respond to the COVID-19 outbreak effectively. Unfortunately for us, COVID-19 is essentially our SARS moment. All we can do is work to pull through and learn for our future. A slow response and a lack of preparedness for a pandemic should never be an issue again.